Hey, Dr. Johnson, Better Life Family Chiropractic. I want to talk a minute about disc injuries. This is a somewhat common thing. Most people don't know when they have a disc injury. People tend to call it sciatica. So if you have pain, electric sensation shooting down your leg all the way down to we'll say the knee, calf, even down to the foot or down to the toes. If it's going past the knee, most likely it's starting from here. Most people are going to tell you, they're going, oh yeah, your piriformis muscle right here in your butt, you got to stretch that out. We're going to give you that. We're going to stretch your hamstrings. Well, if the problem is actually in the disc, starting from here in the spine, doing those forward bends, doing some of those stretches is going to make the problem worse. This is a mechanical issue. Unfortunately, most people don't know, most docs don't understand disc injuries. And I'm talking even chiropractors, most chiropractors, physical therapists, medical doctors, they don't really understand the function of how a disc injury works. And this is something that me and I can only name 2 other docs in the state that really get how this works. And so I'm going to just explain a little bit about the disc. So a lot of people call this a slip disc or whatnot. A disc doesn't really slip. What happens is that you get tears in the ring. So a disc is built a lot like a jelly donut. So you have these rings around the outside, same construction as a radial tire. And then in the middle, it's this jelly filling. And you can get tears through these rings, and that jelly filling starts to squish out. If it goes all the way through, tears all the way through, that's what you call a herniated disc, and that jelly filling is coming out, putting pressure on the nerve here, that's then shooting all the way down the leg to the knee, foot. Can be, depending on how bad it is, the worse it is, the further down it can go. You can have a disc injury that only radiates to the butt. Or if it hasn't torn all the way through, that disc may just start bulging out the side, so it hasn't torn, but the same effect happens. That disc puts pressure on the nerve, shoots down the leg. So let's look at the mechanics of this so you can understand. So let's look at, so this is the back of the spine, this is the front, just like what we're seeing here. If I bend forward, it's going to squeeze wear on that disc. It's going to squeeze the front of the disc. And what's that going to do to all that stuff? It's going to push it straight back to those nerves. Bam, lights it up. So what is the thing that people are doing? They're like, oh, I need to stretch this out, my back hurts. What's the first thing they do? Boom, forward bends. Like, oh, I gotta stretch my hamstrings out, stretch my back out. Holy moly. If it's a disc injury, if that's the root of your sciatica, that is gonna do nothing but make it worse. So we gotta do things the opposite. It's more extension stuff. So you gotta be extending backwards. So if we squeeze at the back of that disc, where does that stuff go? It goes forward, away from the nerves. Perfect. So things to look for: radiating pain that's coming down the leg. That can be a sign of a disc injury. How do you figure that out? You go see a doc, come see me. Someone who really understands sciatica, disc injuries, slip disc, that sort of stuff. You got to figure out what the root of the cause is, because it may be the piriformis, but too often that's what people look at. It's like, oh, piriformis syndrome. People are obsessed with that. It's, usually not that. You have an issue with that, give me a call. I'm the best in town with them, so I'll help you out. I've got an exact protocol to get you out of that. I see it time and time again. I'm the best around. Give me a buzz, okay? 464-0444, Better Life Family Chiropractic. We got you taken care of, guys.